My name's Bendel. I'm a public health specialist in the Department of Public Health. I think public health is one of those kind of underrepresented professions which Penny referred to earlier in terms of professions that are not probably as involved in these some of the work that the LC has been doing, but hopefully through the next stage of the LC, be able to improve that, and my work in this particular hopefully be a bit of a trailblazer into encouraging people from public health to get involved in these sorts of schemes. So my research was around research culture and evidence-informed policy making in what's known as health determinant research collaborations, and I'll explain what they are in a minute and how we measure that. So there's three broad phases to it. First, I did a simple theory of change, just to kind of describe the factors that might act as barriers or facilitators to the actions that HDRCs are doing, and the extent to which those actions have their desired effects. I did a bit of a literature review, secondly, to identify and categorise various tools and frameworks for measuring aspects of research culture and evidence-informed policy. And thirdly, I've been involved in the design and delivery now of some primary research to explore the practicalities of how HDRCs have developed and implemented baseline assessments of research capacity, capability and culture in their particular areas. What are HDRCs? There's been a bit of a resurgence in interest, I would say, in health inequalities following the COVID-19 pandemic, which really brought those inequalities starkly to light. The NIHR has funded health determinants research collaborations to boost research capacity and capability, specifically within local government, and to create and embed an evidence-informed culture within local authorities such that evidence is used more systematically as part of the policy-making process, particularly where those policies impact on health and health inequalities. Manchester City Council was successful and been awarded full HDRC status from the 1st of January of this year. It is now one of 30 HDRCs across England, Scotland and Wales, as shown on the map, and Manchester's ring there in red. So given the stated aims of HDRCs, the question is, how do we measure the extent to which HDRCs have actually been successful in improving research culture as a step towards evidence-informed policy making? One of the key lessons from the kind of evidence-based medicine movement, which was very strong in the 80s and 90s, has encouraged the view of policy making as something which is rational, structured, and is about essentially solving problems. So research evidence is gathered on a policy issue, then it's used to formulate and steer policy, which is then implemented and then evaluated, and then refining that. So that's reflected in the idea of the policy cycle or commissioning cycle, which is kind of very common in a lot of the guidance from the NHS about what commissioning is. And that's the sort of model which is on the left of the screen as you can see it. But in practice, research evidence is seldom the main driver of policy making. And the decision involves making a trade-off between what research is telling you and a whole range of other competing factors and preferences. And the policymakers don't really have the time. They need to consider all of the evidence that's relevant to the issue, and they may base their decision on their established beliefs, their emotions, and their familiarity with certain types of information. So, and the adoption of evidence-based intervention is also linked with existing governance arrangements, so how local authorities or organisations operate, what the rules of they are, and how they encourage policymakers to frame the problem. So do they encourage them to frame it in economic terms, financial terms, social terms, etc., and whether establishing operating procedures for how they do business favour some sources of evidence and participants over other. So we know there's a very strong favouritism towards numbers and quantitative information over qualitative information, particularly in the NHS. And because of that, it's more appropriate to think of policymaking as being evidence-informed rather than evidence-based. So the first thing I did as part of my research was to establish a very simple theory of change in which I attempted to kind of put together some of the actions that HDRCs might be putting in place to inform the culture of evidence in policymaking in their areas, and some of the factors which might act as barriers or facilitators to whether these actions have their desired effects and outcomes. So as I say, it's a very simple theory of change illustrated in the slide. So, for example, HDRCs might be involved in work to try and improve the way that they communicate the benefits of research to policymakers, which they would hope would lead to more engaged and involved policymakers as a result of that. But all that depends on the extent to which policymakers are receptive towards evidence in the first place and are predisposed to using it because of their professional expertise or preferences. And they are the kind of moderators, the sorts of things that act as moderators in the middle bar of that particular theory of change. The second thing that I did as part of my research was to undertake a scope and literature review to identify and, importantly, critically assess a range of tools and frameworks for measuring different aspects of policy making, which I've listed there on the slide. So I identified 11 specific tools published between 2002 and 2024, so 20-year gap between some of those. 3 of those 11 tools were developed in the UK, and the remaining 8 were in Australia, Canada, and the USA. One of the other things that kind of categorises those tools is that some of them start with the aim of measuring a particular element of an existing theoretical framework, such as the Spirit Action framework, but others don't start with a predetermined theoretical framework in mind, but instead attempt to generate that framework through the evidence that they're reviewing and structure discussions with subject matter experts and system partners. I then put that through a kind of funnel, if you like, and use that to develop a typology that can be used to compare and categorise these tools and frameworks based on different factors, such as the academic discipline and background of the authors, the year in which it was developed or published, the focal point of the tool, so whether it's focused on measuring individuals, teams, or organisational attitudes, behaviours, what the underlying theoretical framework, and as I've described, whether that was an existing framework or one which was developed in the course of developing the tool, the nature of the instrument that's used to do the measurements, was it a questionnaire, was it an interview framework, etc. What sort of policy level was it designed for? So was it designed for use at national, regional, local level? And what was the setting in which the tool was designed to apply? So was it a government department, a policy unit, a clinical team, and so on. The third part of my work so far over the course of this year is to use those findings and other associated reading to inform the design of a research study, which I've developed in collaboration with colleagues from the University of Manchester, a Department of Public Health, to explore the practical aspects of how HDRCs have developed and implemented those baseline assessments of capacity, capability and culture in their areas. So how have they done it locally? What have they learned from that? And how they use those existing tools and adapted them to fit local context and requirements. So we've been carrying out a series of semi-structured interviews with HDRCs across the UK, from as wide-ranging as Aberdeen right the way down to Cornwall, to explain how they've gone about undertaking their assessment, what worked well, what challenges they faced, whether there are any specific elements of the process that they found helpful or problematic. And we're also looking at whether the results of those assessments have led to any changes to the work of HDRCs. So as a result of those, did they create any new programmes of work or reprioritise existing programmes of work? And we hope that the results of this will inform the evidence base around HDRCs themselves and will be helpful for HDRCs to help them understand what their colleagues have been doing and to inform their own work locally. So finally, what was the kind of learning from this? So in terms of the learning from the actual research, as I said, policy making may be informed by evidence, but is rarely based on it entirely. There's a range of tools and frameworks out there for measuring different aspects of research culture and evidence-informed policy making, but a lot of those may not be suitable for use in a local government context. The main reason being their length and sometimes inappropriateness for use in, as I said, a local government context. And we also got insight from the interviews that we carried to date that actually qualitative research, talking to people in local authorities, was more useful than just a self-completed kind of survey tool to kind of generate some kind of statistical findings. From a personal perspective, I've had the opportunity to apply my kind of basic theoretical knowledge of literature research and critical appraisal to a real research topic. Also had the opportunity to go through the university's research ethics process, which was a a real eye-opener. I thought just naively ring people up and say, hey, do you fancy a chat? No, you can't do that. And also kind of undertake some qualitative data collection, analysis, and writing as well. So finally, just like to acknowledge support of my two academic supervisors, Professors Roman Kozlov and Aparna Verma, and my colleague Eliza Varga, who's been helping me to develop and rerun the research study that I described earlier on, and also members from the HDRC evaluation subgroup who've given their time to actually kind of be interviewed by us to ask them about their work to date. Thank you.